I did triathlons for about 10 years, but I ran for over 20 years. And it was like the constant training, literally every day, whether it's running or swimming or biking, that was, progressively making it worse. I knew I had to get something done.
So Susan had, for what I treat, a fairly straightforward routine problem. She had a long-standing scoliosis to her spine, with slow progression over time. Over time, basically, her spine not only was scoliotic but became more degenerative and more stenotic. So she had some stenosis at the lower part of her spine, some narrowing of the spinal canal, and some pinched nerves. She had chronic and slowly worsening back pain just from the arthritis and the deformity that she had. She had some imbalance to her spine. She started tipping over more in the frontal plane.
So Dr. Lenke made a very convincing argument why I had to have my full spine done, because he basically had ascertained that my spine was going to the right, that if I didn't correct it, I would be looking at surgery in another 5 years to correct the rest of it. And he said it's a quality of life decision, but I just had so much confidence in him and his team.
The bottom line is she had an elective spine surgery that it was her decision to undergo it. In talking with her, she realized that the pathway she was on was not going to lead to any improvement. She had failed all non-operative treatment, and at this point she elected to undergo surgery, which I advised her to have as well. And thankfully she's done very well with that. But it's some problem that is a very common spine deformity problem, because as we age, patients who did very well with their scoliosis deformity over many years of their young and middle-aged life just basically worsen in an older life and become symptomatic enough to require surgery.
And I had no fear that day. I had total confidence. Anyone going into 8-hour surgery would probably be freaked out. I felt in total comfort with him. My surgery was in June. I had help at home for about 6 weeks. And then I went back to work probably a little bit too early after 2 months. I think that whole experience was just incredibly comforting.
No matter what your surgical problem is, we have basically not only a surgeon, but a surgeon who specializes in your problem available. Between the 12 surgeons that work at the Och Spine Hospital, there's not any area of spine disease in children or adults that we aren't basically nationally and internationally recognized for.
Would I recommend Dr. Lenke and the Och Spine Hospital? Absolutely. And I have recommended it.